Jaideep Bajaj, Chairman, ZS.
So, AI can have all the way from macro applications to micro applications in healthcare. So, let me just pick on some of the micro ones because they are pretty important too. So, one really important application of AI is in rare diseases, in trying to figure out where the patients are, because patients in rare diseases are often misdiagnosed for years. And AI can be used to say, wait a minute, I picked up a lab test in this geography of this type. And if you go through patient records, you can actually narrow it down to the patient, and then you can narrow it down to who are the key doctors who may have seen that patient. So that's an example of a micro application. Other micro applications that are really important are, if I am a physician, AI can look at the patient records of my patient and give me a suggestion as to the likely diagnosis I need to make. And so that can be a very, very important one. Another example of a micro application, I'm a patient and I have an app that's reminding me to say, I haven't taken my medicine because it knows I didn't open my pill box, or it's reminding me to do my exercise, or it's saying hit this button if you want to reach a specialist right now because you need help. So these are examples of what I call micro, meaning at the individual level. But then there are macro ones. How do we make clinical trials more effective, faster and cheaper, and use AI to recruit the right patients and the right physicians for the clinical trials. Use AI to make it easier on the patient in terms of the burden of the clinical trial, meaning if I have to do a bunch of tests and come to a center and that's a big burden, can I use tools like my iPhone and like simple tests around retina, saliva, blood pressure at home and not have to have the burden. Another macro application may be in the early stages of pandemics. How do you start to pick those up with AI? And even days and months saved in that can have huge ramifications on global health. So I think some of the micro applications are going to be coming more in the short term, meaning I think the patient support, that's a no-brainer. That's going to happen. I think a patient identification, that's a no-brainer. The physician assistance is going to take some time because a lot of doctors will resist the idea that an AI can actually give me advice on how to diagnose a patient. So that is taking time for sure. So I think AI has different kinds of challenges. So one kind of challenge is in the data itself. So one thing is the data missing? Meaning there's some very rich data available, for example, in the United States, but in India, we're still trying to figure out if we can create a unified health interface. So I think that's one I call the missing data challenge. The other thing is the biased data challenge. If my clinical trials were done using a white population instead of a black population, or using a rich population instead of a poor population, it can affect the way the medicine might work. So that is another different kind of challenge. And finally, there's a challenge around trust. That if I'm a human being and I don't trust the AI, I don't trust that my data will be kept private, I don't trust that it will be used in the right way, then I may not even use the information, and that's a very large challenge that governments around the world have to overcome. So on the challenges, as it relates to India, there are some very unique challenges. I think some of the challenges are around access. That a lot of our population lives in villages. Now, do they have access to, some of them may not even have access to internet. Some of them may not have access to the basic institutions that they may need to be at least slightly close to get benefit from healthcare. So access is definitely a large challenge in India. The other one is affordability. That a lot of the things that come with a price tag. And I think we will have to find ways to overcome some of these access and affordability challenges in a country like India. So at ZS, we've taken an approach around being an analytics-based firm that tries to use hard data and advanced analytical techniques to help solve problems. And we solve all kinds of problems in healthcare, all the way from biomedical research. How do you scour through all this piece of information to come up with what proteins might solve a particular kind of disease? So we have a biomedical research practice around that. In clinical, how do you accelerate clinical trials? How do you identify the optimal clinical sites? How do you make sure health equity is part of your clinical trials? Moving on to the physician space, once you have a medicine, how do you make sure that the right physicians are educated about your medicines? Moving on to the patient space, once you have a patient on your medication, how do you make sure the right patient services are being used by the right patients? How do you make sure the right patient experience is happening? And so we work in this entire space. As an organization, some of these spaces come into what our clients like to call sales. Some of these spaces come into what our clients like to call marketing. Some of these spaces come into what our clients like to call R&D. And of course, technology is underpinning all the work that we do in all these spaces. So by the way, our company is just about 40 years old, literally about a week ago. But our journey in India began in 2005. And conventional wisdom with other companies at that time was sort of low-cost back office, and we did not follow that. We went with a high-talent team that was directly in touch with our clients. So we call our India group a capability and expertise center. And so our India people are involved in client presentations, client contact, client requests for proposals, in hackathons with our clients. As a matter of fact, our India office team has helped us set up an offshore center in Buenos Aires. Our India team is a source of talent not just in India but also in other countries. A lot of people, when they transfer from India to our other offices, have gone on to different leadership positions. Our senior most level, which is partners and associate partners, we have more than 100 of them in India today. As I look at India in the future, it's going to be at the forefront of solving some of the larger problems that I think the world is solving right now. Large language models, the connecting the dots across different players in healthcare, which is payers, providers, pharma. Our India people, I think, will be a very important part of running our company. As we talk about the future, I want to talk about some things that will change and some things that never change. Some things that are changing is solving new kinds of problems. Even though we were an analytics and math company in the early days, nowadays we are the AI company, and large language models or Gen AI is a big part of our future. Connecting the dots across different healthcare spectrums is going to be a big part of the future. But the other thing is that, as I spoke earlier, this idea of sales, marketing, and R&D, a lot of our future will also include supply chain, corporate analytics, infrastructure work. The thing that has not changed at all is our culture. And our culture has really three very important components. One important component is this idea of value to clients, getting it right and making sure they are getting value. The other very important component is treating people right. All levels, all functions around the world, treating people and putting them at the center, treating people right and putting them at the center. And the third component is the idea of integrity, meaning doing the right thing. So, thanks.